Hi, my name is Vivian Turn. I'll be doing the skills video administration of intradermal injection. I'm wearing my uniform, I have my badge, I have all my supplies. My supplies consist of a pair of clean gloves, 2 alcohol pads, my vial, gauze. I have this post-it note. There's nothing on it, that's just all I'm showing you. It's just a regular blank post-it note. It's just to show my supplies, so my camera will focus on my supplies when I show it to you. So here is my tuberculin syringe. For this particular injection, the syringe we need has to be 1 milliliter. And for the needle, it has to be a 25 to 27 gauge, 3/8 to 5/8 of an inch. Also, if you see my video become blurry here and there, that's only because my camera's trying to focus on me. It's only for like a split second. I promise the video is not edited in any shape or form. Now that I've covered all my bases, we can proceed. I'm going to verify the provider's orders and then verify the 6 rights of medication administration, which is the right patient, drug, dose, time, route, and documentation. We're going to check the medication order in the EHR, and then we're going to verify the medication against the MAR. That's the first time. We are supposed to do it 3 times before we administer any medication to a patient. The medication I have on hand is tuberculin purified protein derivative, 5 tuberculin units over 0.1 milliliters. The order that is given or prescribed to the patient reads a tuberculin skin test, 5 tuberculin units over 0.1 milliliters, intradermal injection times 1 dose. If I've done my math correctly, it is 0.1 milliliters. That is the 1 dose I'm supposed to give the patient. Now that I've verified everything, I'm going to take all my supplies, go to my patient's door, knock on my patient's door, enter the room, close my patient's door, close my patient's curtain to ensure patient privacy. I'm going to put my supplies down on a flat, dry, clean surface. I'm going to perform hand hygiene and introduce myself to my patient. Hi, my name is Vivian. I'll be your nurse today. Can I have your full name and date of birth? I'm going to check their wristband for 2-patient verification. Is the correct patient? Okay, Mr. Smith, are you allergic to any food, medication, or any environmental factors? No? Perfect. Give me 1 moment, okay? This is where I verify the medication against the MAR a 2nd time out of 3 times. It is the correct medication. Okay, Mr. Smith, before we proceed, I have to tell you everything we're doing today. So the doctor has ordered that we do a tuberculin skin test, which is a TB test. And what's going to happen is it is a delayed hypersensitive or hypersensitivity lymphocyte reaction. So what's going to happen, I'm going to inject slightly underneath your skin. You might even see like a little bump form on your forearm. And that's supposed to help us indicate if you've been exposed to tuberculosis. You're going to come back in 72 hours, and from your reaction based on that injection, we will determine if you've been exposed to tuberculosis. Now, some common side effects are maybe like slight bleeding for a few seconds at the site. You can have bruising at the site. It can be like itching or swelling at the site. If that happens, please do not scratch yourself. Do not put any pressure on it. Some adverse side effects means that we absolutely do not want that to happen. Or if you have shortness of breath, a fever, or you can have a rash. If those happen, you have to let me know as soon as possible, and I will notify your provider immediately, okay? So just let me know. On a side note, when we administer the injection, there may be some slight tingling or burning sensation. That's just a heads up. Do you have any questions for me? No? Perfect. And then I'm going to verify the medication against the MAR for a 3rd time, and now I'm good to administer the medication. So I'm going to perform hand hygiene 1 more time. And then I'm going to put on clean gloves. I'm going to take my vial, take one of my alcohol prep pads. These are open due to practice, but in real life, if they are open, I would not use them. Take this, dispose of it, the trash, clean the top, dispose of that, take my syringe. As I said previously, our dose for this particular patient is 0.1 milliliters. So I'm going to inject air into the syringe, 0.1 milliliters. And I'm going to take off the cap, put it down, insert this, insert the needle, inject the 0.1 air into the vial, invert the vial, and draw up 0.1 milliliters. We want to make sure that there are no bubbles. If there are bubbles, then we will kind of like flick our syringe. I'm going to show you that it's 0.1 milliliters. 0.1 milliliters. Okay, so now that that's correct, we're going to use the swoop method. Let me put this on the side. We're going to use the swoop method. Go like this. Put that down for now. Throw that away. And then we're going to also assess the site for any lesions, any discoloration, and we're going to palpate for any tenderness. Now, for this patient, we are doing his forearm, but if the forearm is not available, you can use the upper back. On the forearm, it needs to be, well, below the antecubital. It has to be 4 fingers or 3 fingers. And then above the wrist is supposed to be a whole hand width. So right here in the middle is where we would do the injection site. That is where this is. So this is where we would have it. Now that we've done all the particular tests, and we will take the alcohol prep pad. That way, go in the center, wipe 2 inches, inside to out. We'll then take our syringe, uncap it, make sure the bevel is up, hold it like so. Use our non-dominant hand. Make sure that the skin is tight. We're going to go at a 5 to 15 degree angle, and we want to make sure that we have resistance. We're going to advance through the epidermis 3 millimeters, and we want to meet resistance. I do feel resistance, and we're going to inject. Nice. Inject slowly. Okay. We should see a bleb. I do see a bleb. We should see a bleb that is 6 to 10 millimeters. It should resemble a mosquito bite. So now we are going to grab gauze, gently put it over, take out the syringe. We're going to put this in the sharps container. I'm going to see if there's any bleeding. There's no bleeding, so there's no need for a band-aid. I'm just going to throw that away, throw this away. I'm going to make sure that my patient is in a comfortable position. He's in a comfortable position, as he's told me. And now I'm going to take off my gloves. Only inside, yep. Take off my gloves, dispose of that. And then I'm going to perform hand hygiene and document the procedure.